So I'm going to be injecting a little bit of deoxycholic acid, which is also known as fat dissolver, into Wendy's, her arm right here through this region. So a little bit of the bra fat, a little bit of just that little tiny bit of underarm bulge right here, and a little bit of flank right here. So what happens with deoxycholic acid is it's injected, there's a little bit of anesthesia in it, and so there's a tiny little bit of burn, but not bad because then the anesthesia takes over, and instantly the fat cells start to lyse. And then your body has to reabsorb that exploded fat cell. And so it takes a little time, up to 3 months to see the full effect. Still less than waiting for liposuction results. And this is considered a no downtime procedure. So you can literally walk in, have this done, walk out the door, get on with your life. Okay, so just go ahead and just put your arm back like that. So I've marked out a small area right through here. This is her second treatment of treating this area, and I'm just going to, we're just kind of touching it up. We're perfectionists here, just looking for that. This area is just such a hard area to tone for most patients. So just looking for that little bit of help with contouring and muscle definition right through here on some of these stubborn fat areas. So it burns just a little bit as it's going in, but again, there's a little anesthesia mixed in, which helps with that. You doing okay? Mm-hmm. Okay. I like that I can control the area that I'm treating. Also, this can be used for touching up. Say someone's had liposuction in the past and maybe they have just a little tiny bit that needs to be tweaked, so we can use it for that also. Can you turn this way for me? Mm-hmm. So this is very subtle. Again, she's already had some previous treatment. So we're just looking for this little tiny bit of bra fat that kind of hangs over the edge of the bra to kind of dissipate. That way when you're wearing some of that athletic wear, it has a little bit smoother show on the outside. Otherwise, sometimes there's a little bit of when your shirt lies over the top of it, there could be a little bit of bulge, and we just want to make that flat. So, almost done with this section. It's very quick, not a lot of prep time involved. And again, she's not limited on what she can do after this. So, okay, you can go ahead and put your arm down. And then this section right through here, it's a little bit broader section, but again, not a ton of, this isn't going to be like super drastic, but it's something that she'll notice just because of the attire that she likes to wear. She wants that smooth line, so we're just helping that transition so there's no ridge over the underwear or the waistband. Okay, it's ready. So just little pokes, and then I just kind of spread it out. Okay. Mm-hmm. I'd say the most commonly injected area for this product is actually under here, and I'll be probably doing some of that a little bit later in the day. But that one has a little bit of swelling involved, so if you are planning on any recovery time, just be aware that the neck area is about the only one that it was great when everyone had to wear a mask. They could hide the swelling really easily, but that is one area where, especially if it's the first treatment, the swelling can be a little bit profound just for a few days. So just plan ahead on that one. You can see there's almost no bleeding or bruising. Okay, can you turn around? We'll do the other side. So this side has just a little bit more fat right here. So You can kind of see what I'm talking about now with that little bit of kind of bra, what we call bra bulge or bra fat right there. So, and I've already prepped these areas beforehand with alcohol. Usually within about 2 to 4 weeks, she should notice some significant improvement. So initially those cells are gonna lyse and swell a little bit, but then it will go down. And then also there's a little bit of, so sometimes people wonder, if I take the volume out, is the skin going to be loose? And the product actually causes a little bit of irritation. And so with that irritation, there's actually some skin contraction or retraction. And so it actually seems to tighten the skin up. So we have evidence that it's the opposite effect. We don't have saggy, loose skin after, but it actually contracts and tightens and looks nice. Okay, just switch your hat up like that for a second. So the cost, everyone wants to know how much does something like this cost and how many treatments they might need. It depends on how much volume we're trying to take down and how kind of what your level of perfection is, whether you need 1 treatment or 2 treatments, sometimes 3, but it's rare. So again, an area like the flanks is usually about 9 mLs, 9 to 12 cc's. So about 4 of these, 3 to 4 of these syringes is about $650. So it's actually pretty cost, like comparative to Cool Sculpting. They're charging about $600 for one section. And once this fat dissolves, the fat cells don't grow back. So yes, you do have, it's not going to treat every cell, but those cells that dissolved aren't going to regrow. So what happens with weight loss and gain is the cells that are remaining can still expand if you did gain weight, or they can lose volume if you lost weight. So that's what we see with like liposuction patients. When patients say, oh, I had liposuction in one area, but now it seems like I get fat in the areas that didn't have liposuction. Well, that's not true. You already had those fat cells there. So what happens with weight loss and gain is it has to go somewhere. So wherever those cells are left over is where you're going to see that expansion or contraction of those cells or shrinking of those cells, depending on whether or not that cell is bigger or smaller at the moment. So right now we're just targeting these. Again, these are hard to exercise areas. So common areas would be like the tummy or under here, sometimes the knee, the top of the knee, or inner thigh, like some people call that, where they want the thigh gap. So those are just very common strategic areas that are very hard to spot treat with exercise, that we can just take little sections and treat it with the deoxycholic acid, and then within a couple months, it's pretty much gone. Okay, hot stuff, we'll get you all cleaned off, and
Thank you.
next time she'll be in the really skin tight outfit.